Great. Hello and welcome to Montclair's Spring 2024 Graduate Open House. Before we begin the presentation, we ask that you mute or turn off your microphone. Due to the large number of registrants, our presenter will not be able to answer questions until the Q&A portion at the end of the presentation. Please utilize the chat function to ask your questions at that time. Please be aware that this information session is for the pre-licensure Master of Science in Nursing, which is for non-nursing college graduates looking to enter the nursing profession. If you are a registered nurse in the state of New Jersey looking to obtain your MSN, please reach out to Ms. Evelyn Rogers to learn more about our post-licensure online MSN degree program. Her contact information has been provided in the chat. If you are looking for detailed information on financial aid options available to graduate students at Montclair, please consider attending the financial aid information session later today at 5 p.m. Our presenter is unable to answer questions on this topic. A registration link to that information session has been provided in the chat. With all of that said, thank you again for joining us today to learn more about the Pre-licensure Master of Science in Nursing degree program. Today's presenter is Dr. Elizabeth Zweigaft, Pre-licensure Program Director and Associate Professor.
Thank you, Christopher, and welcome everyone. I am so excited that you all have decided to come here on a Sunday when we're finally getting to see the sun and learn more about our pre-licensure MSN program. So as Christopher mentioned, I'm going to go through the program, tell you about the courses, the curriculum, the admissions requirements, our clinicals, everything you might need to know. And then at the end, I will look through all of the questions and I will answer them to help you with your decision as you're looking. I want everyone to know that and remember that this is for entry for the Pre-licensure MSN program for the summer of 2025. Registration is closed for our summer of 2024 class. Okay, so we'll get going. Okay, so I'm, as I said, very excited that you've decided to come and that you are thinking about a career in nursing. Right now, nursing is such an excellent profession to go into. There is such a need for nurses out there that your entrance into the field will be most welcome. As you can see by our slide, nationally, the RN employment is projected to grow 6% from 2021 to 2030. So according to the U.S. Bureau of Labor Statistics, there will be greater than 203,000 openings for RN over the next decade. So as I've mentioned, you coming into this profession at the right time. So what I'd like to do first, before we get into the program specifically, is just talk a little bit about the School of Nursing. Here at Montclair, we educate undergraduate and graduate students to engage in the full scope of practice as registered nurses. We are looking to educate and graduate nurses who, as I always like to say, I always use the 3 C's that are caring, compassionate, and competent. So coming to Montclair, we will give you those, those qualities and enhance the ones that you already have. We have many programs in terms of our undergraduate. We do have a BSN program. We also have an RN to BSN program, as Christopher has already mentioned. If that's what you're looking for, we can help guide you to the people you would need to talk with. We have an online MSN program, and that is for students that already have a RN degree. So we either have a bridge program or a direct entry MSN program, but both are online. And that has 2 tracks. It has the education track and the administrative track. And then the other program, which is what you are here for today, is our pre-licensure MSN program. And that's what I'm going to be focusing our time on. So as an overview, our program is a 71 full-time accelerated program for students that are not nurses, but who have graduated and have a bachelor's degree in another field. So it is basically a face-to-face program. It does have some online components and some hybrid components, but the majority of the program is in person. It is done over 7 sessions. So you start in the summer, you would go summer, fall, winter, spring, summer again, fall. You get the second winter as a break, and then you finish up in the following summer, that summer. Okay. Once you complete the program, you are eligible to sit for the NCLEX, which is the licensing exam, which is what you need to practice for nursing. I know that many students ask me during the course of our Q&A, what is our board passage rate? And for our MSN program, it is a little over 90%. So our students are doing exceptionally well, and they are getting jobs. Our program differs from just say an undergraduate program because what we look for here is we have a specialty in care coordination and transition management, because at the master's level, we want to give you that edge over other people to have a real understanding and of this area, care coordination and transition management, because that is something you will need throughout your career. What do people do when they leave the hospital? How do we help them manage their care? Although that is a very brief little blurb on what it is, you will certainly learn a great deal more once you get into the program. Okay, so as I mentioned, I've already given you how our program runs starting in the summer, and it is a combination of in-person classes, some that are online, some that are hybrid. We have a outstanding simulation center, which I will talk about in a little while, but you will have courses within that simulation center and labs where you do things like health assessment and foundations. And again, I will talk about that. And then, of course, the clinical experiences. And I'll go into detail about those clinical experiences a little bit later. But we have excellent partnerships with a lot of the surrounding community hospitals. And, you will be doing a lot of work within those hospitals. Okay. Okay, so what I thought would be helpful next is just to go over what would your life look like as a pre-licensure MSN student. So once you start with us in the summer of 2025, you start by taking 3 classes. They are Principles of Pathophysiology, Principles of Health Assessment, and Information Technology. These are the building blocks of our program. They will get, what you need to get started with everything that is going to come after that. Principles of Health Assessment is a lab course, and that is you start right away learning how to do health assessment and start, interacting with, patients and within the simulation center as well. For the fall, you then take Fundamentals of Professional Nursing, which is usually the course most students are most excited about because that's where you get to do things that nurses do in terms of their skills. You learn how to give injections, you learn how to give medications, do dressing changes, and all kinds of different things during that course. You also learn about nursing research and principles of pharmacology. That is a theory-based course and a very, very important course because a lot of what nurses do is manage medications. And in your role, especially with our care coordination and transition management, medication management is very important to our clients. After that, you will see we have a winter course, and that is just an issues in nursing course. Our winter session goes right from the day after the fall semester ends and is a 4-week course that goes right to our spring session. Right now, as I said, except for that winter, the following winter, there are no breaks, and you only get off whenever the school is closed, like say for spring break or any holidays that happen to fall. But there is no gap in time, as I said, because it is an accelerated program. The next session, number 4, then starts in the spring, where you're going to take your introduction to care coordination, which is the premise of your program. You also will be taking genetics and genomics, and you will be taking your care, that CCTM stands for care coordination and transition management of adult and elderly. That will be your first clinical based course where you go into the hospitals and you put into practice what you learned the first 2 sessions. You will do that as well in Nursing 502, but in a situation in an area where the care coordination is really highlighted. The summer after that, you take care again, CCTM, childbearing families, and which is maternal child health, and children and adolescents, which is pediatrics. So those 2 courses run over the summer, and again, both of those have clinical. So, but just like the semester before, most likely you're in class 2 days a week and you're in clinical 2 days a week. Okay. And then your next semester, which would be your fall. And in your fall semester, you take population and global health and CCTM, adult and elderly too. So that is your second adult and elderly course, or as we also call them, your med surg courses. After that, again, both of those have clinicals. So you will be in clinical twice a week and in class twice a week. Session 7 is the spring semester where you're almost done and will be graduating. You will take your last course in terms of like PEDS or OB. You take behavioral health, and you also take 641, which is your capstone in care coordination, which is where you really start practicing even more so like a nurse. You will have a a 10-hour clinical day where you will be working with our clinical specialists and really getting prepared to graduate. That semester has a lot of things that you need in terms of getting ready to take your boards. And so you can pass your NCLEX and start your practice as a nurse. All right. So let's talk a little bit about our incredible facilities. Montclair's nursing program is a very young program. All of our equipment is state of the art. Our facilities are new and beautiful. If you have time, I strongly suggest that you work with admissions and find a time where you can come and hopefully see our facilities. We have our School of Nursing is located on the main campus. It has a wonderful simulation center, and I'll talk about simulation in a little bit, and I'll talk more about the center itself. We have quiet places to study. Our classrooms are what we call fully mediated, which means we can do almost anything in them. So, whether if we needed to bring in a guest speaker and we wanted to utilize different things, it has all the technology, all the bells and whistles that we need. We have high fidelity laboratory rooms. Again, I'll talk more about that in a little bit. But basically, as you can see by that picture, we have our 3G SimMan, and they can do everything basically but get up and walk. You will be doing simulations, and again, I will talk about that in a little bit. We also have medium fidelity simulators, and we have office spaces, ambulatory office styled exam rooms where again, you'll be learning how to do your full health assessment. We try to make it as realistic as possible. So as I keep saying, I was going to talk about our simulation. We have an excellent simulation program. We feel that simulation is vitally important in terms of your learning. It is a safe way to learn things. So I'll give you an example of you're in a hospital and you're involved in a code. Well, you might get to watch it, you could see it, and maybe you're the one that got to do it, but your other classmates aren't going to be in that room because there's going to be a lot of things going on. In simulation, we can simulate a code. People can be involved. They can see what happens. We can see whether or not the patient was saved and had a great outcome, or whether it was a poor outcome and the patient passed away. And again, it's safe. So if the patient passed away, we can always bring them back where we can't, obviously, in a clinical situation. So there's a lot of ways for you to learn. It's a safe environment. One of the most important parts of simulation that we do is the debriefing. What could we have done better? What went really well? What are we going to do next time? And it's a great, wonderful learning experience. So throughout your time at Montclair, you will have different simulations and different courses. So for example, in population health, we do a disaster drill, so which the students love, and it's a lot of learning and a lot of fun. You know, who do we tend to first? Who do we go to second? How do we manage that scene, right? Our simulation, as I said, is state of the art, and our faculty have done a lot of work and preparation in terms of doing simulation the best way possible. You can see by the slide, we have it says up there NCLEX, and that is a endorsement. We have gotten certified by that, excuse me, certified by that agency, because our simulation and the way we do simulation is top notch. And that's a hard thing to get. And a lot of the other programs, you know, in the state may not have that type of recognition. Where do we go to clinical? We try to keep you within an hour of Montclair. So please keep that in mind. Okay, so within an hour of Montclair, we don't take into account where you're coming from, where you live, or anything else. Your schedules will be given to you, and then it will be easy for you to register because you'll know exactly what you need to take and where you're going. We try to get you to a variety of hospitals so you can see different environments, different places, and gives you more of an idea of the type of environment you may want to work in once you graduate. So as I said, where do we go? We go to wonderful places. We use a lot of Atlantic Health Systems. We use Morristown. We use Overlook. We use the Robert Wood Johnson Barnabas Health System. So we go to Cooperman Barnabas in Livingston. We go to Newark Beth Israel. We go to Jersey City. You know, and I'm sure at this point we're also looking maybe to expand into Claramas. So it just depends, you know, where the best experiences are. We use St. Joe's Medical Center. We use Hackensack Medical Center. We use Kessler Rehab. You use that a great deal because that is where you go for your introduction and to be able to learn what care coordination and transition management is. We also use Mountainside and a lot of different other agencies, especially for your community-based experiences. Okay, so the next thing that everyone always wants to know is, how do I get into the program? What do I need to do? So as you can see by here, this is what you need in order to apply and be and then have your application looked at. This is a very competitive program. We get a lot of applicants for approximately 35 to 40 students per cohort. Okay, so you need to send in transcripts from every school that you've attended. You need to have a minimum of a 3.0 GPA. You need to take sciences, and I'm going to tell you exactly which ones in a minute, but you need to take your science prerequisites, and they must be completed within 5 years of your admission date. So unfortunately, we are not going to accept anatomy and physiology from 1990. So if that's when you took A&P, you're going to need to retake that course. You need to send us your resume. You need 2 letters of recommendation and a 1-page personal essay or statement that kind of gives us an idea of why it is you want to change fields, right, and go into nursing. There is an application checklist. Okay, once you start applying, it will be on the graduate admission site, but all things are due by Friday, January 17th, 2025. Okay, that means at this point you would have needed to graduate from your program. If you're taking a bachelor's degree now, you cannot come into the program at this point if you're not graduating till May or June. Okay. All right. So here it is. Here are the prerequisite courses. Okay, so you need to take anatomy and physiology 1 and 2. Each one of those would be a 4-credit based course with a lab. All right. Microbiology, again, would be with a lab. Chemistry is a 3-credit course with, you do not need a lab for that course. Statistics, you need human growth and development. And another name for that is usually lifespan development. What we are looking for is that you take a psych course basically that covers from birth to death. So it just can't be child development. It just can't be adult and elderly. It needs to be something that covers from birth to death. And then a nutrition course. And in that, we are looking for a nutrition course that would tell you about nutrition's impact on the body, go over different types of diets and things we would need. It's not a nutrition course for exercise or something like that. So, please take a look at what the courses you're looking at may have. Your courses can be taken at Montclair or they can be taken at any other accredited program. Okay. Again, the prerequisites need to be completed within 5 years. And I will talk about, I see a couple of questions coming up, and I will, as I said, we'll answer those questions later. Okay. So next part is just so you know, our program is accredited by CCNE. And we are also right now probationary from the New Jersey Board of Nursing because, again, we are a new program and that we want to let students know that, excuse me, that you will all have to undergo a criminal history background check as a prerequisite for licensure as a registered nurse. You need to do that as well when you enter the program. And so if there's any issues with your background check, that is something that on an individual basis we would need to address. Okay. All right. I believe, yep, it's time for question and answer time. So I will do my best to answer the questions in the chat. If you have them, please feel free to put them there. The first question reads, can the prerequisites be considered if over 5 years old? Nope, they need to be 5 years from, when you're going to be starting for the sciences. The other ones, your statistics, your growth and development, and your nutrition do not have to meet that requirement. Can organic chemistry be used for a chemistry requirement? Usually we will look at everything. Again, we look at the student when we're looking to admit as an individual. We will look at your transcript. We will see what you have. And then if we have questions, we may ask you to provide a description of a course or something like that. But it's hard to answer that as a blanket statement because everybody's situation is individual. Okay. Does developmental psychology count? Yes. So developmental psychology, lifespan development, and human growth and development would all count as that prerequisite, as long as the course that you took goes from birth to death. Okay. Another question, is ethics a prerequisite for the program? One of my advisors sent a document that included ethics as a prerequisite. It is not a prerequisite for the pre-licensure MSN program. I think it's an outstanding course to take and would certainly love to see you take it. We will go into legal and ethical issues that you will encounter within nursing, but having a background in ethics would always be welcome. Okay, next question. Again, I've really answered the human growth and development question. So as long as it covers from birth to death, the title, we're not as hung up on the title. Okay, how do we apply for the prerequisites? So if you would like to come to Montclair to do your prerequisites, you would go through the admissions office. And at this point, you would probably do it as a visiting student because you'd like to just take your, those prerequisites here. Okay, what jobs can nursing students from this program expect to qualify for this degree? I would say in the beginning, you will qualify like as a nurse that would go on the floor because this is an entry into practice MSN pre-licensure MSN program. So you would want to go on the floor, work in whatever area it is that you would like to work in, get experience, but no, because you have a master's degree, you will probably go up the ladder, so to speak, quicker. You will have that extra information on care coordination and transition management. So if that is hopefully the way you want to go, you would move into that direction pretty quickly. This next question says, I applied to the undergraduate nursing program and was wondering if they would honor my general education requirements, being that I have already obtained my bachelor's degree. Unfortunately, we do not accept students into our pre-licensure BSN program unless you are out of high school. The only option for you would be for the pre-licensure MSN program. Next question, if we are taking our last prerequisite, will we be able to submit our application? Yes, you can submit your application as soon as you would like, as soon as they open it up. And you're more than welcome to do that as long as all of your prerequisites are in by January 17th and your transcripts are there, that is fine. Is there any scholarship or graduate assistance? As far as scholarship, there is none to my knowledge, but that doesn't mean there aren't any. I would please talk with the graduate admissions office. How many students do you accept every cycle? We accept anywhere from approximately 36 to 40 students once a year. When exactly in the summer does the first session of the program begin? I do not have a date yet, but traditionally it has started within the second week of May. But that's not a guarantee for the class of 2025, okay? Will you accept online prerequisites? We do accept them from certain schools. So for example, we do not accept things from Straightliner, I believe. There is one of them that we don't accept them from. Your graduate admissions counselor can help you with them. But other programs, we certainly accept online programs. How is this MSN degree in care coordination different from an NP or other master specialty? This is an entry into nursing program. A nurse practitioner is an advanced degree where they can prescribe and have have private practice if they so choose. So if you want to be an NP, you can certainly come for your MSN. You would be entry into practice. And then what you would do is, since you have a master's, just go straight for your doctorate and for your NP. So you'll have your doctorate of nursing practice. All right. If your GPA is a 2.9 but had good grades as the prerequisites, you won't be able to apply since your requirement is a 3.0. So we do look at each person as a whole, and we will look at students that are close and see what you did beyond. But again, this is a very competitive program, and there's no guarantee that once students are admitted that we will get to even, to a 3.0 threshold. It really just depends on the class that's being admitted and who applies. But we will look at students that are close, and take everything into consideration. Will I be able to go into leadership after this program? So as a master's prepared person, you will be getting, leadership in some of your classes and how that goes. Again, you won't have experience in terms of working on a floor and being a nurse. So it's hard to say what type of leadership you're thinking of going into. They're not going to hire you as a nurse manager or anything like that in a hospital without experience on the floor. I sent my application in on January 14th, 2024. Would that be for the summer cohort? Yes, that would have been the deadline for the cohort for now. How does the typical tuition look like and the average aid for the program? As was mentioned in the beginning of this session, I'm not really able to answer any of the tuition questions or any of the aid questions. There is a session directly after when I am done talking, I would strongly suggest that you go to those sessions and ask your questions there. I believe this year's projected fees for the cohort coming in this summer is a total of $54,000. But again, that will probably change for the following 2025 cohort. Okay, does an MSN make you a nurse practitioner? I answered that question already. It does not. Does test and measurement and statistics count towards the statistic requirement? Again, it may. In your case, we would probably want to see the course description of the course you took, as long as it has similar requirements as a statistics class, then it will probably be okay. But again, it's hard to answer individual questions at this time. Can your graduates eventually apply for post-degree certificates in various APN specialties at different institutions, or would we have to get a second MSN? It depends what programs you're looking at. There will be some where you can get some degree certificates. Most likely you would have to go back again, either for your MSN as an NP, or what I would suggest, going for your DNP. Will you have the same opportunities as someone with a BSN? And the answer to that is yes. You will have the same opportunities and hopefully even more, and your ability to go through the system and go higher up in the ranks, so to speak, would be a little bit faster because you would have your master's degree. Can some of the prereqs be taken at a community college? Absolutely. You can take your prereqs wherever you would like. All right. Is it possible to send a transcript after the due date? Not really, because I'll need, once everything needs to be submitted by the date so we can look at everybody appropriately. Will retaking a science course for a better grade be held against you in an application? Again, that would depend. It's an individual thing. We look at everybody individually. How many sciences did you retake? Did you retake all 4 of them, or was it just one? In your essay, does it explain why you might have needed to retake that course? So again, we look at everything when we look through our applicants for admissions. Okay, I've mentioned about the cost. How long is each section? They're traditional sessions in terms of they're 1 semester long. Right now, Montclair is looking, instead of a 15-week semester, by the time you would get here, they are looking at a 14-week semester, but in any way, it will be the same as taking a semester-long course, except for the winter, which is an extremely accelerated 4-week session. I sent my application before January 15th, but still waiting for my transcript. Is this a problem? It shouldn't, okay, again, it's hard for me to answer because I don't know, what's missing. I would suggest that you call Arturo in the graduate school and ask him what's the status of your application. Okay. Oh, thank you, Jennifer. As you can see, Jennifer O'Sullivan, who is from our admissions department, has put into the chat a resource for the current tuition that would probably help answer any of your tuition type questions. The next question is, how large are the class sizes? As I've mentioned, we take between 36 and 40 students. So that would be your cohort, and you would be with that group of students for those 2 years. If we want to visit, who do we call to schedule a time? I would give a call to the admissions office. You can reach out to Jennifer or Arturo. They are the best ones to talk with. How long do you have to hear back regarding a decision if you're accepted or not? So with for next year, the January 17th deadline, usually we will start looking at applications shortly thereafter. and we will start admitting, usually at the end of January through February. And just I should mention at that admission for this, whether it's this year, next year, whatever, is on a first come, first serve basis. So we will admit people once we get to our number. Let's just pretend it's a 38. The first 38 students that send in a deposit are in the class. If we admitted 45 students, the rest will be put on a wait list. So just because you were accepted, if you do not accept your acceptance and deposit, that doesn't guarantee you're going to get a seat. So once you know this is where you want to go, whether it's for some of you sound like you're here for this semester, for this upcoming year or for next year, you need to deposit in order to assure that you have a seat. What kind of academic support does the program offer? We have a lot of academic support. The university itself has all kinds of support, whether it's a writing lab, math labs, different things. Within our School of Nursing, we have, besides myself, who's the program director, you will have a academic advisor who will be there to help you. You will have, a faculty advisor who will be there to help you. You will also have an academic advisor. We also have a success coach who then arranges things, has different workshops and things, helps arrange for different tutoring that students need. So depending on what it is you need, we do have a great deal of support that you can reach out for. Is it okay to submit our transcript if we're waiting to complete a prerequisite and then submit it? You certainly can. It will be called what we call IP in progress. But again, we will not look at your application until the course is completed, and it has to be completed by the deadline. How much is the deposit to secure a spot? I don't know. So Jennifer, if you could answer that and put it in the text, I will come back to that. Jennifer, just put in the information for Arturo, so you can click here. There's his phone number, or as it said, there's a click here where you can go if you'd like to speak to him about any of the things I have mentioned. Let's see. The next question is, at what time is the application, there we go, due for cohort 6? So cohort 6 will be for next year. And as I've mentioned, the deadline is January 17th, 2025. All right. Thank you, Christopher, for putting that in the chat. And thank you, Jennifer, for putting in the deposit, which is a $200 deposit. Okay, after work, the next question is, after working as an RN for a while, would my chances to go into nursing leadership, such as nursing management, be better? Yes, the more experience you have, the better off you're going to be when you apply or go into those in those type of programs. And that really also depends on where you're working, what their requirements are, and what they are looking for. Okay, so at the moment, I don't see any more questions in the chat. I will give it another minute or two just to make sure that nobody has any other questions. And then we will go from there. You can see if you still have questions after this is over, there is a phone number to call and an email address that you can start. In terms of, do we have an exact start date for cohort 5? I believe that it's going to be May 13th. As I said, most of the start dates are within the first 2 weeks of May. There you go, May 13th. Okay, just looking to see if anybody has any other questions. Okay, oh, hold on. Let's see, where'd we go? Okay, I asked earlier. So another question on career options. So what your career options would be the same as anyone graduating with a BSN. just you would be moving up most likely quicker. You can work in the hospital and, in an acute care setting. A lot of community settings may or may not take grads right away. They usually want a year of hospital experience. The same goes by doctor's offices. Again, you would have to research. You can work in any place that would hire a BSN or a pre-licensure MSN. So you're just starting out. So usually most people do start in acute care settings, but some people do want to go right with this care coordination and transition management. We have had people, want to work at Kessler. So that's in rehab. Again, it would just depend what you would like to do. Are there any advisors or reps that help you through the application progress? And yes, you can reach out to Arturo. And again, Jennifer put his information into the chat. Does developmental psychology count as human growth and development? As I've mentioned previously, whether it's human growth and development, developmental psych, lifespan development, as long as it covers from birth to death, that is what it needs to do. Okay, and you are very welcome for the information, and I am very glad it was helpful. Are there certain standards? Oh, hold on a sec. In terms of absences, you really can't be absent. There are very little reasons for absence, especially once we're in clinical. You need to be there. There are clinical hours that you will have to meet. A random, you're sick, that's not going to be the end of the world once in a while, but don't plan on taking vacations, going away, or doing anything during this time period during an accelerated program. There isn't that kind of time for you to do that. Would I be able to go straight for my DNP once I'm done with your MSN? Yes, you would. All right. Well, you are welcome. Any other questions? That's a very good question that just popped up in the chat. Somebody asked, can I work during this program? So we do not encourage you to work because it is so intense and there is a lot of stuff to do. There's a lot of work that is involved. We understand that you may need to work. I would suggest, if that is the case, that you have a job that is very flexible, that lets you take time off, especially during exams, and that you work as minimally as possible. We can't stop you from working, but we do not take your work schedule into account when we are planning the courses and the classes that you take. Do clinicals happen at any shift? They may. They can happen days, evenings, weekends. We are guests within the hospitals. I will request things. If they cannot honor our request and they give me a shift, that on a Saturday, then we go on a Saturday. If it's on a Sunday, we'll go on a Sunday. But we try to keep them, either the day or evening, somewhere from 7 to 10 at night, in that time period, and not on weekends. But that doesn't. We have had weekend clinicals. Is there housing available? That I do not know. So maybe the graduate program can answer that one. Do we offer assistantships? I believe we do. Again, that would be a graduate school question. How long does it take to get the results of my application? Again, we usually, once the application closes in mid-January, it could take till the end of February. The hours for classes are also anytime from 8 a.m. in the morning until 5 or maybe later in the evening. You have to be available any day, all the time. And then whatever it is for that semester, then that is what it is, but you have to have that availability. Clinicals, most clinicals start at 7 a.m., which means you have to be at the hospital by 6:15, 6:30, depending on which one, and where you're going. So again, you need to have that flexibility. The course load I put up, so At the end, you will be able to go back and access these slides within the next week or so. You can go back and look. It's usually somewhere between 10 and 12 credits a session.
All right, that looks like all the questions. So thank you to Dr. Zweigaft, Carolina, and Jennifer as well for assisting everybody in their questions today. And thank you everybody for joining us today to learn more about the Pre-licensure Master of Science in Nursing degree program. And just as a quick reminder, there is a financial aid information session right after this at 5:00 p.m. You can go on to montclair.edu/graduate and you'll be able to find the registration link there. And also a recording of this presentation will be sent to all registrants in the following week. Thank you everyone and enjoy the rest of your day.